All right, for the 4-week post-surgery update, um, join me for my morning walk. We just had quite a storm here, so it delayed me a little bit, a lot of rain, but just figured I would do this update with a little walk and talk. So again, 4 weeks post-surgery today. Actually, right now, I was probably about an hour into the surgery. So, I've been at home for 3 weeks now. I think really this week has been a lot of progress, and really the only issues have been small kind of annoyances and just getting used to everything. But so this is again my morning walk. I usually try to do about 30 minutes in the morning, and then try to do another 30-minute walk around lunch if the weather's not too hot, and then also after dinner at night, at least a 20-minute walk. Usually I'm a little bit more tired at night, so that's one of the things that I'm getting used to and kind of noticed that I'll wake up in the morning and still my sleep hasn't been back to normal. It's been pretty good, but I'll wake up anywhere between 5:30 and 6 typically, and I'll go ahead and get up and kind of go through my morning routine. But one of the things that I really noticed about that is the morning time I have so much energy. Up until lunch, I almost feel normal and really want to get after it and do a lot of stuff. And I've noticed I can pretty easily overdo it in the mornings if I'm not careful because of that. But what's been happening this week is typically after lunch I just kind of feel worn down. I'll lay down and just kind of rest all afternoon, and I think that's again just a little bit of a kind of a frustration. The other thing that's interesting still is if I do take a nap in the afternoon, it takes me a good hour to get up and get moving afterwards. But I think that will go as I build my endurance. And again, 4 weeks out, I'm sure that there's still a lot of healing that's needed. The other things this week, so started this week on I guess I go back to last Friday, but I had gone to the Coumadin clinic last Friday. Numbers were still a little high, so I had to draw out of my arm. Adjusted down my dosage for a couple days, and went back this week on Monday. That point, my numbers were a little bit high, but it was the first time that the finger prick had worked, and I did not have to go get the draw out of my arm, which was nice for me. But again, adjusted my numbers down a little bit, and then here in a couple hours I'll go back again to the Coumadin clinic for my check. So hopefully we're closer. I'm still in the point where the surgeon wants my INR between 2 and 3 for the first 3 months, and so I've been a little bit over 3, anywhere from 3.2 up to 3.8. So hopefully today we'll get closer to the 3, maybe a little bit under it. So that'll come a little bit later today. The other thing while I'm talking about medication is really this week and in the last couple of days I've been able to space out even the Tylenol. So pain is pretty much, I would say normal levels. And so yesterday I only had 2 doses of the 650 milligram of Tylenol, and that was first thing in the morning and before I went to bed. I think those are both times of first thing in the morning I've just been laying all night, and so everything's a little stiff, and then the end of the night just a full day of usage kind of wears on you. So, but that's good pain wise. It's been pretty much going again. Nothing really in my chest. The thing I've been battling this week, and I say battling in a kind of tongue-in-cheek way, but my lower back on my right side has been hurting. And again, I think that's just as my body overcompensates for different things. It's my core has kind of lost some strength, but the last few days been doing more and more stretches and a little bit of light core work, and that seems to have helped it a little bit. But you know, the way that pain's happened, it doesn't happen first thing in the morning. It's typically after lunch when I would feel that pain. And initially I thought it might have been almost like a kidney infection because it's around the area. But it seems to be more of muscle because as I stretch and things like that, it loosens up. So again, small little nuisance to deal with, and nothing really to complain about. The other thing is, even as I've watched my previous videos, and I've noticed it this morning too, is my chest itching, and it's not the incision. The incision hasn't. It's where I had to shave my chest and stomach, and as that hair is growing back, it rubs on my shirt, and so I've noticed I'll do this quite a bit, but it's getting better. That's been a nuisance for the whole time as I've been healing, especially as I've been walking. It bothers me, but anyway, that seems to be good. Again, sleep seems to be mostly getting better, and then appetite is where it needs to be. So not a big update. I think this week has been great. Again, mornings I feel almost normal. I do have some tightness still in the chest, obviously, but a lot of walking, 3 walks a day, and then just trying to kind of stay busy throughout the day. Earlier this week we went down and went shopping for kids to get some sports equipment for fall seasons, and also went to the mall and kind of walked around, and that was a good outing. Excuse me, good outing, just to kind of be out of the house for a little bit. But those also seem to wear me down a little bit just because of the kind of constant going. But otherwise, again, it's just building the stamina back up, and little pains here and there, but nothing major. Everything seems to be good. Heart rate's been in check. I haven't had another episode with that. Again, as we still work to get my INR in level. Again, I'll go here in a little bit, and then that's basically it. So that's my 4-week update as I do my little walk that I've been doing every day, and then I'll have an update because Monday, so in 3 days, I'll have my 1 month post-op appointment with the surgeon, and so I'll do an update then and kind of overview of the first full month there. But again, 4 weeks, 3 weeks at home. Activity level is great, energy level great in the mornings, kind of dies a little bit in the afternoon, but otherwise everything seems to be going along pretty well, and just ready to continue the recovery. So again, I'll put out a video again after I do my post-op, 1 month post-op, this coming Monday in 3 days, and see you then.